as we all know that MIPH, this is a new technique. So this was like introduced in 1996. So any surgical procedure we should do only for grade 3 and grade 4. Grade 1 and grade 2 we can manage with conservative treatments. And in grade 3, grade 4, when we should go for MIPH, that is the main point. Whenever you are having piles which can be reduced, like grade 3, in those cases you can go for MIPH. Because in grade 4, when the piles is completely prolapsed, even though you do the MIPH, some portion will still be outside. So the satisfaction level will not be that much. Eventually the patient will have that satisfaction level, but that will come after 1.5 to 2 months. So the results are little not same satisfaction level in compared to the open one. Second thing, when the patient is having anal stenosis for any reason, like if he had undergone some surgical procedure, or if he is having some congenital anal stenosis, in those cases also, even though he is having grade 3 piles, he should not go for the procedure. Then in cases when there is failure of treatment of the stage 1, grade 1, grade 2, in those cases also you can opt for MIPH. And one more thing, like this MIPH is more cost effective. So if you want to save money in the terms of more economical gain, in those cases also because whenever you go for MIPH, the hospital stays very less and you can return to your work very early, because the pain score, what we do is VAS score is very less. Like out of 10, at the end of the second day you will be having like only a score of 2. At the end of the 4th day it will be like approx 1. So you can return to your work very early, like on 3rd or 4th day also you can come. But in the like in the previous surgery open surgeries which we used to do, like Milligan Morgan, in those cases there is open wound. That wound will take time to heal, like it can take 3 weeks to 4 weeks. Till that time the patient will have discomfort, and till that time the patient can abstain from going to hospital his work. So when the patient is having economical issues also, he can go for this. Many people think like MIPH stapler, this is going to be a very costly thing, but it's not. This is like a misnomer type of thing. So these are the indications when you should opt for MIPH. One thing more, like if you are having large external component, or if you are having large skin tags, in those cases also better avoid MIPH, because those MIPH guns are not going to cure those big anal tags. So in those cases also you can go for it. Only combined procedure you can opt, or you can go for completely open procedure. What should be the ideal diet which the patient should follow? See, the main reason for these piles, what we see in day-to-day practice, is because of the constipation. So the patient is either straining too much or is having very hard stools. So post-op, what we are going to do is we are going to create a regime in which the chances of constipation is less. And second thing, the patient has already undergone the surgery. So now we should give something which is like soothing to him. It should not disturb that area, it should not irritate that area. For that, the stool should be like soft. If he is passing hard stools, then again he's going to have irritation and pain. If he's taking like very spicy foods, again he's going to have irritations. Second thing is like you have to keep yourself hydrated. Most of the people say that take plenty of water, but what plenty of water? It should be like plenty of water means like whatever is the body weight, it should be at least 5%. Like if you are like 70 kg, so it's like 3.5 liter. So that should be the sufficient amount. So take plenty of water, keep yourself hydrated, avoid the things which is going to dehydrate you, like coffee, alcohol and all those things. Second thing is increase the fibers. For coming to fibers, whenever you are increasing the fibers, it should not be like on the first day only you are taking lot of fibers and amount, and it should not be like you are taking only one type of fiber. It should be like a mixed thing. And second thing, it should increase gradually. So for the post-op, for the first 1 week, we give patients some laxatives, but laxatives should not be given for long period, because it's like many laxatives are habit forming. So go for more fiber-rich food like take this whole grains, take some vegetables, try to include some this tubers or roots in your diet, because they are like very much rich in fibers. Then among fruits, better go for completely ripe fruits. Avoid partially ripe fruits, because they again cause constipation. So go for like papaya like things, or guava, or you can go for apples. One thing about fruits is like they are very much rich in flavonoids, and flavonoids is one thing which decreases your bleeding tendency in piles. So you can include that also. Then one thing is more like you should avoid things which is like difficult to digest, and like red meat. These things should be avoided in the post-op period. And you should also avoid the processed food which is not lacking fibers completely, because those things are again going to worsen your constipation. So other than these things, in post-op period, patient should we prescribe them to take regular exercises, go for regular exercises, take regular sits bath, and other than this, we should avoid prolonged sitting on the toilet and straining. These things we should avoid. So more or less these things, if the patient follows, he will be like much better in terms of prevention. Thank you.